Clinical Pharmacist Solutions is a multi-award-winning recruitment, training and clinical services provider that specialises in supporting and utilising clinical pharmacist skills in primary care. We provide a range of services such as recruitment, CQC health check, PCN support, competency assessment, training for pharmacists and technicians, clinical services, QOF prevalence optimisation and other services. Our mission is to accelerate the transition of UK healthcare into the digital era by utilising innovative technology and harnessing the skills of pharmacists. Our vision is to see instant access to healthcare for patients. We are experienced in supporting primary care organisations and understand the challenges that you go through. We have developed a number of tools and put processes in place, and over the last couple of years we have gathered a large database of pharmacists and are connected to over 8,500 pharmacists nationwide. We have trained over 250 pharmacists in the last 12 months alone and supported their transition and developed their career within primary care through our CPD accredited and award-winning training programmes. We are NHS Data Security and Protection Toolkit compliant and ICO registered. We currently support multiple GP surgeries, PCNs and GP federations nationwide and support them with their clinical pharmacist needs. Our Implement Competency Assessment service is a free service designed for large organisations that employ multiple pharmacists at different competency levels. Over 1,800 pharmacists have completed this assessment to date. We will arrange a short meeting to understand your requirements and then assess each individual pharmacist and provide a report to their employer on each of them to help identify individual training requirements. Here is an example of what the report will look like. Pharmacists will be assessed against the 4 levels of competency that we see in primary care. Our training pathway mimics the natural progression of pharmacists that we see in primary care and is comprised of 4 levels. Our training programmes complement the CPPE pathway and increase the pharmacists' and technicians' capacity to support their practices and the PCN. Our Clinical Pharmacist Accelerator programme is our flagship training, which takes pharmacists straight to level 2 of our CPA pathway and takes around 2 weeks, which would normally take around 6 to 7 months without the training. This is heavily used by PCNs and federations as part of their induction programme and is bought in bulk, so every time they enrol a new pharmacist, they will put them through this training. Another example of our training programmes is the A to Z of running asthma clinics. This enables the pharmacist to independently run annual asthma reviews. Other training programmes we have available are enabling clinicians to deal with prescription-related dilemmas, clinical medication review training, what good looks like, EMIS Web and System 1 training, running SMR clinics, conducting audits, enabling clinicians to run hypertension clinics, and our Pharmacy Technician Accelerator programme. We have a great faculty in place. All of the faculty members have experience in primary care. Our QOF Optimiser service. As you're most probably aware, QOF payments for GP surgeries are directly proportional to the number of patients they have on each chronic condition register. Our QOF assessment will identify patients that are missing from registers due to coding omissions or incorrect coding. We will then get this list of patients approved and code them correctly onto registers so registers are optimised. This means patients get the umbrella of care they need and the GP surgery is paid correctly for caring for these patients. We offer a free QOF assessment to identify any areas of potential missing income. PCN Pharmacist Supervision. As part of the PCN contract DES, each pharmacist must be clinically supervised by a senior pharmacist. Sometimes this can be difficult for a PCN to facilitate in-house, in which case we can provide them with a senior pharmacist to accelerate pharmacist development and reduce the number of queries directed to the GP. CQC Medication Safety Service. Medication safety can occasionally drift while we are busy dealing with urgent tasks. It is easier to maintain medication safety rather than keep trying to achieve it. and it's always good to have someone with experience and expertise to conduct a quick assessment to make sure you are on track. If a practice are concerned about the medication safety aspect of things and they're either expecting a CQC visit or they just want to improve things, we can support with this. With our CQC medication safety service, our experienced pharmacist team will undertake a free health check to identify any areas in which the practice need further support to comply with CQC requirements. Do you have a dedicated medication safety champion who sets up and runs searches regularly, has the experience and the expertise in this, and keeps regularly up to date with changes and the team are aware of all the work that's been done? If you were to get a CQC visit notification next week, you will not be able to complete all the work and prepare for it in time. These are the things that have to be done throughout the year, and this is where we can help. If you would like to go ahead with our free CQC health check, all you will need to do is sign our electronic agreement. Our CQC specialist will then run our safety searches and produce a report. We will then ask you to complete our short questionnaire and organise a Microsoft Teams meeting to clarify and present the findings and provide recommendations. We provide clinical services to primary care organisations to free up GP time and support them with their workload using pharmacist skills. This service is being used by primary care organisations nationwide, including some of the biggest federations. This service includes a range of options outlined below, such as prescription tasks, clinic letter processing, note-based or telephone medication review clinics, structured medication reviews, chronic condition management clinics, and minor illness clinics. Our aim with clinical services is to provide safe, efficient, and consistent service delivery. Therefore, everything we do is systemised into standard operating procedures. For example, with prescription reauthorisations, every pharmacist that completes this will follow our standardised 5-step approach. We have an SOP for processing discharge letters and a 7-step process for conducting a clinical medication review. We also understand that every surgery works differently and therefore complete a client-specific protocol for each GP surgery we work with to ensure we provide a smooth and consistent service delivery. Recruitment service. Demand for healthcare continues to outrun clinical workforce supply in the NHS, which means recruiting the right skills at the right time is crucial to managing your workload effectively. It can be challenging for practices and PCNs to recruit themselves due to the advert only attracting a small talent pool with few candidates, or the process being very labour intensive and time consuming. In addition to that, many GP surgeries struggle with screening pharmacists effectively in order to find an appropriately skilled individual. Many practices come to us because they have tried advertising on NHS jobs and Indeed for a couple of months without much success. Ideally, you need to have a wide reach and a robust screening process, and this creates the ideal selection environment. If you have faced any of these challenges before, our recruitment service will help overcome these obstacles. The key elements of our recruitment process are we have the advantage of having access to the largest talent pool possible due to our large database of pharmacists, and we advertise on a minimum of 6 different platforms. We have a robust screening process, and our recruitment team are industry experts and understand your requirements like no other. These processes result in presenting you with the top talent. Our support doesn't stop there. Once a candidate is selected, we provide further support to induct the pharmacist so they can hit the ground running and provide value from day one. This induction process includes our award-winning Accelerator training programme, an induction checklist designed specifically for pharmacists and technicians that are new to the sector, and access to our senior clinical pharmacist for on-demand peer-to-peer support. We provide clinical services to primary care organisations to free up GP time and support them with the workload using pharmacy technician skills. Common challenges GP surgeries face are workload pressures, managing clinicians' workload effectively, and finding a cost-effective solution to ease pressures. Our technicians-led clinical service is an ideal solution for these challenges that you may be facing. Thank you for showing interest in Clinical Pharmacist Solutions. Please head over to our website or get in touch with us via email or telephone for further information. We look forward to working with you.